no other vaccine has been studied after rapid development like COVID for safety in such a wide way. So I think that is unique. And it's a testament to the people working in our public health system, the CDC and elsewhere, who kind of made sure that the vaccines were safe and are continuing to monitor this.
Welcome to the Bronx Health Reach Community Coalition podcast. I'm Anthony Davis, who will be hosting the podcast. I'm a community health worker with Bronx Health Reach, a 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. For this podcast, we will be talking with folks involved in Bronx Health Reach's COVID-19 and flu vaccination initiative. Specifically, we will have a discussion with Dr. Eugene Schiff and Moria Byrne-Zaaloff. Dr. Eugene Schiff, Clinical Director, Adult and Childhood Vaccines, attending physician at the Institute for Family Health's Stevenson Family Health Center in the Bronx. And Moria Byrne-Zaaloff is the Program Manager of the CDC-sponsored COVID-19 and Flu Vaccination Initiative at Bronx Health Reach. Dr. Schiff, thank you for joining us. Please tell us about yourself and what you do.
Thank you, Anthony. It's a real pleasure to be here. I've been working in the Bronx now for 11 years at community health centers, and here with the Institute for Family Health for about 8.5 years. Obviously, the COVID pandemic was a big part of the last 4 years, and so I think it's really important that we're having this podcast. I work here at the Stevenson Family Health Center. I see patients of all ages who are adults, children, pregnant women, and elderly. And I do HIV care, and I also try to coordinate the vaccination efforts within the organization, not only at this clinic, but throughout the entire organization, including the Manhattan, Brooklyn, and upstate sites. We are trying to reduce the disparities and in vaccination coverage and increase the coverage overall for COVID, flu, and other vaccines.
Great, thank you, Dr. Schiff. And Moria, thank you for joining us. Please tell us about yourself and what you do.
Yeah, my name is Moria Byrne-Zaaloff. I'm the Program Manager of the Flu and COVID Vaccine Initiative of Bronx Health Reach. And in my role at the Institute, I focus on increasing vaccination rates in the Bronx through education, tabling events, vaccine events, presentations.
Great, thank you. But I do want to give some context not only to you, but to the listeners of the podcast, that the questions that we have for this podcast were originally taken from a family member of mine that got the original doses, but then never got a booster afterwards. So moving on to the first question that we have for both of you. Why should I get vaccinated for COVID, especially if I've already had it this season? Doesn't that mean I now have immunity?
Well, that's really a good question, and that's the one we're struggling with at this time with everyone who's coming into our office, and also nationwide. There's a relatively low rate of vaccination with the most updated vaccine, even though they've been available since the fall. I think, and then there's actually some new recommendations that came out that suggest that people who are over 65, who even already got one dose of the updated vaccine, should potentially get a second dose 4 months after. There's concern that sometimes the immunity will wane, so whether someone's been exposed to COVID or for the previous vaccines, the efficacy of the vaccine or the protection that it provides may decrease over time. So the strategy that the CDC and the health authorities, the FDA, the Advisory Committee on Immunization Practices came up with was that additional booster doses, as we've seen in the past with the bivalent boosters and the booster doses of the original vaccine, and now we have an updated monovalent vaccine that targets the Omicron variants that are circulating, will provide additional level of protection and save lives, basically, by keeping people out of the hospital and preventing death from the newer strains of COVID that are circulating now.
Great, thank you. Moria, would you have anything to add?
I would just say that for those who may have gotten the original dose and think, well, maybe I have some residual immunity or even natural immunity because I maybe got COVID in addition to that, I'd just like to comment on that possible comment that people might make. and that's that your best option is to vaccinate and to stay updated on your vaccinations. Just like with the flu vaccine, that we recommend people get the flu vaccine every year. There's a reason. It's because the virus changes, it mutates. So just because you were protected last year doesn't mean you will be fully protected this year or many months, like 2 years later. With natural immunity doesn't last as long, and there's no guarantee that you will be protected or that it will prevent severe illness. So I really encourage people to get that updated vaccine, especially if you have a chronic illness, you are pregnant, you're over 65. It's really important to get updated vaccines.
So the message is stay vaccinated and make sure you're always updated with your vaccines so that you can keep your community safe and family members safe, I would say, right?
Right. And also I would say this is no guarantee that you will not get COVID. That's a misconception. You may still be infected, but the idea is we want to keep people out of the hospital and keep them from severe illness and developing long COVID, because that can last more than a few weeks. That could last, we don't even know how long. So
Almost 90% of the population had naturally been exposed to COVID-19. So they have a nucleocapsid antibody, and this was taken from blood donors. So they weren't just exposed to the vaccine. Many people got the vaccine early on, when the vaccines first came out. But this is the amount of people that had actually been infected with the COVID virus based on the nucleocapsid antibody found in blood donors. And then it was a little less, it was about 70% for older people. So definitely they're at highest risk because they may not even have been exposed to COVID still, maybe from taking more precautions. But on top of the immunity provided by natural infection, the vaccines then are found, at least from the data that's been presented so far since September, to have an additional 40% benefit of preventing hospitalizations for older individuals, even more so. So older and younger individuals actually, but older individuals are typically hospitalized at a higher rate. So definitely something to think about in terms of our family members, our community members, people living in the same household who may be at highest risk either from age or immunocompromise, and the importance of all of us trying to protect them.
Mm-hmm. And that is not exclusive to older people. Children also get COVID and they can develop something called multi-system inflammatory syndrome. Even though that's pretty rare, it does happen, and it takes a few weeks to even for children to even experience that. So they may have no symptoms. They may be infected with COVID and have no symptoms, and then end up in the hospital with MIS-C. So that could be pretty scary. So everybody 6 months and older should be vaccinated.
Right, and that's with the updated 2023-2024 monovalent COVID vaccine, which comes in either Novavax protein vaccine or the mRNA vaccines from Pfizer Moderna, which many of us are familiar with and are used more commonly. And then it's 6 months and up as well for influenza vaccines, which protect against influenza. So it's a good point to think about the children and protecting those at highest risk. And even the vaccination can be given during pregnancy, so that the protection then extends to the youngest of children through maternal transfer of antibodies up to 6 months before kids can even get their own shot. They have some protection if the pregnant individual mother was vaccinated beforehand.
Mm-hmm. And you can even transfer antibodies through breast milk as well. So children, that's why they're saying that up to 6 months you don't need the vaccine, because children are usually protected against illness in the first 6 months of life if their mom is vaccinated or vaccinated while breastfeeding.
Great. Thank you so much for all that information. I know there's a lot of misinformation out there about COVID, and I think something that we really need to touch on is, are people still really getting sick from COVID and even possibly dying?
Okay, well, we have seen different spikes in the level of hospitalization, but definitely people are still getting sick, and there's still about 1,300 people who are dying every week from COVID. Now, these deaths are definitely trending down, fortunately. There were about 68,000 deaths, or that could actually translate the 1,300 per week into 68,000 deaths. So that it's similar to the amount, it even surpasses the amount of people that die from car accidents. So fortunately, we're out of the phase of the pandemic where 500,000 people had died by 2021, and 1 million had died by 2022. So it does seem like the death numbers are coming down. But even at the lowest point last year, 300 people died over 300 people died per week from COVID. So it's definitely something that we're still seeing. And in the hospitals, there continue to be many people hospitalized, especially over the winter time with COVID, and even all year round, actually.
Great, thank you. Would you have anything to add?
Yes, I was just thinking about the fact that, even as you were saying, I'm thinking about New York City specifically, even though throughout the city the percentages of infections are lower, what we are finding is that those areas that where the vaccination rates continue to be not optimal, not where they should be, we keep seeing infection rates spike. So that will continue to happen as long as people aren't vaccinating. The virus will continue to circulate in those communities. And there's a couple in the Bronx that keep popping up with high infection rates. So it's important to get vaccinated.
Well, as my family member is the one that gave us these questions and helped with facilitating this podcast by even giving us these questions, they really wanted to know, how was the vaccine developed so quickly? Because I think that's what I've heard the most fear about COVID and the vaccine in general, was that it was developed so quickly, and not many people realize what goes into making a vaccine.
That's a great question, and I think it was a really interesting time and process by which these vaccines were developed. In some ways, it was a miracle of modern medicine. It was, challenging. This was a novel pathogen. The genetic code was just released in December and January of 2019 and 2020. So it was really. It was called Operation Warp Speed here in the United States. So in some ways, it was meant to reflect, the effort that was being placed and the amount of resources that were being placed to developing the vaccine. Some people took that to mean that it was too fast, and there were concerns about that. But actually, the mRNA vaccine platform was built upon research from the earlier SARS viruses that had been going on for decades at the NIH. And they really needed to balance the need for speed with the benefit against this novel virus. So if we hadn't developed these vaccines for a few years, like some of the other vaccines take over 10 years in clinical development or longer, then the number of deaths would have been much higher, since the vaccines did save a lot of lives. So there could have been more time to study and to enroll more people in the clinical trials, but then we wouldn't have had the vaccines when we needed them in December of 2020 when they actually came out. So there was the need to balance the potential benefit with the speed. The virus was spreading very quickly, so even for many, the vaccines came too late. It was still too slow. What they did was they overlapped the phase 1, 2, and 3 in the clinical trials. So usually they first test the vaccines in animals and then in healthy individuals to see the immune response. And then they have a randomized controlled trial in phase 3 where they have people get the vaccine and people who don't. And so for the COVID-19 vaccines, at least for the Pfizer ones and the Johnson & Johnson, there were 20,000 people who got the vaccine and 20,000 who got a placebo. And then they compared the rates of people who got sick from COVID or got COVID and people who were vaccinated compared to the people who weren't. And then the Moderna trial had 15,000 who got the vaccine and 15,000 who got the control. So those took a long time, but they basically started producing the vaccines at the same time that the trials were underway. The government had funded all of this in the beforehand, so there was no risk to the pharmaceutical companies. If the trials didn't work, they would have just thrown out the vaccines, and at least the taxpayers basically funded the $2 billion that many of these companies got. So it was quite an interesting coordinated effort. We have a lot to learn from that, I think, in terms of vaccine production and financing and taking some of the risk out and trying to speed up things, especially in the context of a global health emergency, which is what we were facing. One other point that's worth mentioning is that it was an emergency use authorization for the FDA instead of full FDA approval. So it did sort of shorten the time for that full licensing of the vaccine or for the vaccines to become available. But it's worth noting that the actual vaccines, once they were eventually approved fully by the FDA and licensed, were the same vaccines that were allowed under the emergency use authorization. So definitely worth considering the safety of these vaccines. And it's not the first time we've been concerned about a vaccine or any other medical product being safe, and we do want to have rigorous controls to make sure that that's the case, and that it doesn't cause more harm than good, or even if it causes rare cases, which I think we'll talk about in this podcast, that the overall benefit far outweighs the risks.
Yeah, hearing you break it down like that actually definitely puts my mind at ease a little bit as well, because not even I know how the vaccines are technically made, or like how they were rapidly made so fast, and it's because of the years of research that came beforehand on other viruses that were similar to COVID. So thank you for that. Would you have anything to add?
Right. Normally when I'm talking to people in the field or on a presentation discussing this topic, I do highlight something that you brought up, which is that, there was a lot of collaboration across countries, across universities, to find an answer, to find the right vaccine. Normally, there's a lot of competition to come out with the right vaccine because everybody is seeking the same funding, So I think what happened this time is because of that collaboration, because there was less red tape, and maybe I'm wrong about this, but this was my impression from what you said also, that everybody was working towards the same goal. And so that made things, that combined with the shrinking of the phase 1 and the phase 1 and phase 2 into one phase, made things faster, move a lot faster. Did I get that right?
Yeah, I think so. I don't know if they were shrunken, but there was definitely an overlap.
Yeah.
Instead of waiting for the phase 1 to be done before enrolling in the phase 2, instead of waiting for the phase 2 studies of immunogenicity to be completed, the phase 3 enrollment was already starting. And then there was also a time when there was a lot of disease going around, so they could tell fairly quickly that these vaccines, at least the initial ones, were having a 95% efficacy of reducing the risks of COVID and hospitalization. So. That I think helped. If you're studying a disease that's rare or that's not very prevalent, then it may take a longer time to see if the vaccine trials show efficacy. What was the challenge was then to go from 20,000 people in the trial to millions, and to make sure that the vaccines are safe once you're vaccinating more people, because you wouldn't be able to find a rare event in that trial. So I think that's where the post-surveillance studies, I think were more robust from the CDC efforts, where we had this V-Safe program on our phone where we could report any side effects from the vaccine. No other vaccine has been studied after rapid development like COVID for safety in such a wide way. So I think that is unique, and it's a testament to the people working in our public health system, the CDC and elsewhere, who kind of made sure that the vaccines were safe and are continuing to monitor this.
Could you actually add a little bit about what the rare symptoms were from the vaccines?
Sure. So I think there was a lot of concern, a lot of misinformation, but then there were actually some real signals that were found from some of the vaccines. So the greatest risk was found after the second dose of the mRNA vaccines in boys who are ages 16 to 19. There was a risk of myocarditis, which is inflammation of the muscles around the heart. And in that group, it was it was about 1 out of 66,000 or 6,000 boys were at risk for myocarditis. So the risk overall for younger children is about 1 in 500,000 of getting myocarditis, and it was usually within 4 days after the second dose of the mRNA vaccine. So to put that in perspective, it's about twice as likely as getting struck by lightning. So and then this overall risk is higher in men for whatever reason, and in men 16 to 30 years old. So fortunately, that tends to be the group that's at the lowest risk for COVID. So I think that's something to consider in terms of, each person has to weigh their risks of getting the vaccine or the risks of getting the COVID infection. So the risk of the COVID infection is 1 out of 2,000 people have a risk of myocarditis if they get infection with COVID. So that's much higher than the vaccine is the actual risk from the disease itself. So there's no choice. The choice not to vaccinate is also a risk. And to put it in perspective, there's a 1 out of 7,000 risk of death from a car accident. There's 43,000 car accidents each year in the United States. It doesn't make it so we don't get into a car or we don't cross the street. We just have to kind of understand what the risks are out there from different things. And that was one of the main concerns, at least with the mRNA vaccines and the risks. Now, there was another vaccine which is no longer on the market, which is the Johnson & Johnson, the J&J vaccine, and that had a more rare side effect of a potentially fatal blood clot. That was a concern, that vaccine is no longer being used. It was a lower risk. It was 1 out of 200,000, but those blood clots could be fatal. Usually the myocarditis wasn't fatal, but the blood clots could be fatal, and this is one of the reasons why that vaccine, which uses a viral vector, isn't really being promoted or used at this time, at least in the United States.
Another thing I would add is that, just a reminder that American Heart Association recommends that getting the COVID-19 vaccine because it outweighs the benefits outweigh the small chance of myocarditis, and urges everyone to get the vaccine. So this is promoted and supported by the American Heart Association. And that means that even children with congenital heart problems, children born with heart disease, are recommended to get the vaccine because they're at higher risk of complication from COVID if they get ill.
Now, I know some people that did not want to get vaccinated because of those symptoms and because they were worried about it, but they wouldn't talk to their doctor about it. And now, even after getting the original doses, they're afraid of the boosters because they still get sick anyway. So, and they still get sick and they feel awful as if they have COVID without the vaccine, without the booster. So
what I always say to people when they say that is I ask them, well, what are the symptoms you're having? And if they say to me, if they name typical side effects from the COVID-19 vaccine, then I will say, well, that shows that it's working. That's those are expected side effects. And it's just your body, getting, building immunity. So fighting off the infection or what they think is, the body thinks is an infection. So that is a good sign. And it should dissipate or should go away in a couple of days. So that's not unexpected. You're not going to, take a vaccine without having, some people have no symptoms after getting a vaccine. Some people have no fever. Some people do. But it just means that it's working.
Yeah, I think I agree. And there was even some studies that showed that perhaps the people who have that reactogenicity or, side effects from these vaccines, sore arm, body aches, headache, even like swelling of their lymph node in the arm that the vaccine was given, sometimes some of those side effects, while unpleasant, actually mean that the vaccine is working and the immune response is even better than it would be in people who don't have that. So while it's uncomfortable and unpleasant, and I've felt that after the vaccines that I've taken, it may actually just be a sign that the vaccine is working better. And I wasn't sure if the question was asking about those like side effects immediately after getting the vaccine or the fact that people still can get sick with COVID after getting the vaccine. It's not 100% effective.
Well, it touches on both, I would say. So I know there are the symptoms that you would experience from the booster or the original vaccine, but then there are those people that get the boosters and have the original doses and still get COVID and feel like it was just as bad as the first time they had it before the vaccines were even out.
Yeah, and each COVID presentation, each COVID infection, and is going to be variable, and it depends on so many different things in terms of the person who's getting infected with COVID and their immune system and their response and the stressors that their body is underway and the way that the new variants affect them. But there are going to be breakthrough COVID infections. These vaccines are not like the measles vaccines, which are 95% effective, but that's still only 95. The newer vaccines are thought to be maybe about 40 to 45% effective, but it's still an important part of our overall strategy to reduce hospitalizations and deaths. So the updated vaccines are just part of it. These boosters, they do work to reduce the hospitalization and death in the older people and in everyone overall. And it's really just part of the treatment and prevention strategy. There's masks, which can reduce the spread of COVID if you have COVID to avoid passing it to others. There's masks like that can prevent other people from getting it if they're wearing a mask. There's the supportive care, the rest, the fluids, the fever-reducing medications. There's time off work, which not everyone is able to take. And also to rest and recover. And then for hospitalized patients, there's antiviral medications, inpatient management with steroids, oxygen, ICU care. So it's just all part of the response that we have to the pandemic. Hopefully not everyone needs, that latter bit with hospitalization and ICU care. We're not seeing that as much, fortunately, but vaccines are just part of the way we're going to get through this pandemic and reduce the number of people who are affected by it and die.
And the sad thing is that COVID is constantly shrouded with misinformation, and the vaccines are constantly shrouded in misinformation, and it can lead people to not trust our government, the people that are even giving the vaccines. How do we regain that trust, or how do we help people trust vaccines and the information about them?
Well, I think that is why Bronx Health Reach has been, for the past 3.5 years, been present in the community since the very beginning of the pandemic, before the vaccine was available, to build that trust, working with churches, mosques, community centers, senior centers, schools, because the people in those organizations are the ones that are trusted. So the best way to combat misinformation is to educate teachers, ministers, imams, community leaders about the vaccine, about the side effects, all the things we've been talking about, so that they can put it in their own words in a way that is really going to be relatable to people in their community, using their own stories, using their own experiences to color that education and make it interesting and accessible. And we've seen amazing things happen within our communities, like where pastors, where moms have taken over doing all the presentations, doing all the talks, because they are able to reach people and they're seeing the numbers of people lining up for vaccines. They're seeing people join the presentations and listen to them and ask follow-up questions. So we found that to be the most effective way. I mean, there are reliable sites out there, National Institute for Health, Centers for Disease Control and Prevention, but these are federal sites, and from the hundreds of surveys that Bronx Health Reach has done, we've found that, while people trust information coming from federal sites, the people that that really change their minds or influence community members' opinions are people that they know in their own community, family members. Just like you're talking about now, the family members are the ones that influence you in terms of your health decisions. People who are taking preventative care of themselves are the people that influence community members. So Bronx Health Reach, over the past 3.5 years has provided over 12,000 vaccines, and that includes flu and COVID. We have been working with over 50 community organizations. We have reached over 25 partners that we've worked with closely in ongoing community vaccination initiatives. We've handed out thousands of educational materials. The number of presentations we've done, I mean, it's over 70, Zoom and in person. And just the outreach efforts have been incredible and expansive. So, and I think we're really proud of all that work that we've done.
Would you say all the presentations and the information that you give out helps encourage people to get vaccinated?
Yeah, I think it moves people in that direction. Our approach is using motivational interviewing and trauma-informed care approaches. So it's more about moving the needle towards change, right? So it's about getting people the information, letting them think about it. Very often people aren't ready to make that decision to vaccinate at that time. Maybe they talk to people they know, maybe they share the information with them. So the decision doesn't always happen instantly, which is why I think having presentations, making sure the community leaders are involved and educated and trained to talk about these issues are involved, because we do the presentation and then we're not there anymore. But the community leaders are, and see people every day or every week. So they're the ones that are going to answer those follow-up questions most likely. So it takes time. If people are in a position where they are not interested in vaccinating. 4 years ago, we were doing focus groups and surveys on the flu, and we saw the same feedback from people about flu vaccines, which was really, really helpful to help us once the COVID vaccine became available, because we knew what kind of to expect from people's thoughts about the COVID vaccine. We knew what some of the barriers might be. And so that really helped us say, okay, well, what approach can we take to really help people and educate people?
And this is really great work that Bronx Reach has been doing with all these events, and it's countering, so much of what is going on in the opposite way, with regards to some of the social media and the controversies and the fake news. It does spread much easier than the truth in times. And so I think that's where we're at, where a lot of politicians or political candidates or famous individuals or influencers have picked up on some of the anti-vaccination messaging. And that's not new, but it has taken on a new form in the current political context in the United States. So there was a research study that was just coming out this past month from the Pew Research Center, and it shows that only 20% of the people now view COVID as a major threat, and that's much less than the 2/3 that took this pretty seriously in 2020. So it's really fallen out of the perspective of most people as a major threat. 10% are concerned that they might get COVID or require hospitalization. And only 28% say that they've gotten an updated vaccine, according to the respondents to that survey. And 44% say they've gotten the flu vaccine. So while there's some correlation between the two, there's actually been more people who have gotten the updated flu vaccine than the COVID vaccine, even though COVID is causing more hospitalizations and deaths still. And then it goes across political lines. So the study went on to show that 66% of people identified as Democrats have gotten the vaccine, and 24% of Republicans. So that's a 42% gap. It was increasing from the 15% gap earlier. So it's really remarkable to see that. And I think the messaging in the community, we've definitely heard that. As a primary care physician, that can sometimes be one of the most important sources of information is when you go to your doctor, and if the doctor or nurse practitioner or physician assistant or the nurse in the clinic or the other staff recommend the vaccine, that can sometimes be the most influential thing in changing someone's mind or building trust. So battling the misinformation and trying to understand that there's these differential rates of vaccine acceptance by age and even in rural versus urban areas. Here we are in the Bronx, but in rural areas the rates can be a bit lower. And also across the city, we've seen that the rates are different depending on age and ethnicity and neighborhood.
You've been listening to the Bronx Health Reach podcast with your host, Anthony Davis. You can email Bronx Health Reach at bxhealthreach@gmail.com. You could find Bronx Health Reach on social media. For Facebook, Bronx Health Reach. For X and Instagram, BX Health Reach. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health Reach podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health Reach and the Institute for Family Health.